What is herpes zosters? Herpes zosters is a viral infection that causes an outbreak of a painful rash or blisters on the skin. It is caused by the varicella zoster virus, which is the same virus that causes chickenpox. The rash most often appears as a band of rashes or blisters in one area of the body. Where does herpes zosters come from? When you have chickenpox as a child, your body fights off the varicella zoster virus and the physical signs of chickenpox fade away, but the virus always remains in your body. In adulthood, sometimes the virus becomes active again. This time, the varicella zoster virus makes its second appearance in the form of herpes zosters. How common is herpes zosters? About 1 out of every 3 people in the United States who have had chickenpox will get herpes zosters. More than 1 million cases of herpes zosters are diagnosed every year. The risk of herpes zosters increases as you get older, with about half the cases occurring in men and women ages 50 and older. Who is at risk for getting herpes zosters? People who have had chickenpox who are more likely to develop herpes zosters include people with a weakened immune system, such as people with cancer, HIV, organ transplant recipients or those receiving cancer chemotherapy, people over the age of 50, people who have been ill, people who have experienced trauma, people who are under stress. Can you get herpes zosters more than once? Unfortunately, yes you can. One of the biggest myths about herpes zosters is that it can only happen once. This is not true. You can have more than one episode. If you get herpes zosters again, you usually don't get the rash in the same place. What causes herpes zosters? Herpes zosters is caused by the varicella zoster virus, the same virus that causes chickenpox. What are the symptoms of herpes zosters? Early symptoms of herpes zosters may include fever, chills, headache, feeling tired, sensitivity to light, stomach upset. Other signs and symptoms appearing a few days after the early symptoms include an itching, tingling or burning feeling in an area of skin, redness in the skin in the affected area, raised rash in a small area of skin, fluid-filled blisters that break open then scab over, mild to severe pain in the area of skin affected. How long does herpes zosters last? From the time you begin to feel symptoms until the rash has totally disappeared can take 3 to 5 weeks. First, a few days before the rash appears, you may feel pain in an area on your skin. The pain is described as itching, burning, stabbing, or shooting. Next, the raised rash appears as a band or a patch, usually on one side of the body. The rash usually appears around the waistline or on one side of the face, neck, or on the trunk, chest/abdomen/back, but can occur in other areas including the arms and legs. Within 3 to 4 days, the rash develops into red, fluid-filled, round, painful, open blisters. Usually, these blisters begin to dry out and crust over within about 10 days. The scabs clear up about 2 to 3 weeks later. Do you always get the typical rash if you have herpes zosters? Occasionally, some patients don't get the rash. If you have any of the other symptoms of herpes zosters, even without a rash, see your healthcare provider sooner rather than later. There are effective treatments that can be given early in the disease. If it turns out you don't have herpes zosters, seeing your healthcare provider allows any condition that you do have to be discovered and treated early in its course. What is herpes zoster? What is herpes zoster virus? What is herpes zoster in Hindi? What is herpes zoster infection? What causes herpes zoster? What is herpes zoster 1? What is herpes zoster means? What is herpes zoster oticus? What is herpes zoster disease? What is herpes zoster vaccine? Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.